Yeah. Oh, good. Thank you. Yeah. Well, why don't we get started? I know we're a little bit late, so I apologize for that, but I want to thank all of you for coming. There's a big online audience as well, so there's a lot of people that are tuning into this program, and I'm really excited about that. So let me start by issuing my own personal welcome. The Chancellor is going to also welcome us, but really, thank you. Thank you for your interest and for attending this and for your participation, which we really look forward to in a very direct way. We really need your input on the issues that face us with these complex opportunities that are also full of challenges. So as we go forward with using artificial intelligence tools in health and medicine. So let me step aside and ask Chancellor Sam Hawgood to welcome us. AI is really a tool that Sam recognizes and has stood up as something that's going to be really important for us to be considering across the campus for all of the things that we do. So Sam, thanks for joining us.
Thank you, Keith, for the invitation to just say a few brief remarks here to kick off what I think is an incredibly important and very timely subject that you're going to grapple with throughout the day. So thank you for being here, everyone. Now, this workshop originated out of the UCSF Precision Medicine program, and we're very fortunate that our Vice Chancellor of Science Policy and Strategy, Keith Yamamoto, has led this program over more than the last decade. Spearheading our efforts in precision medicine here at UCSF, but also at the state level and at the national level. Indeed, Keith and UCSF were instrumental in establishing the concept of precision medicine with the publication in 2011 of this important monograph from the National Academies entitled Towards Precision Medicine. And it was really the first time that that term was used in a formal way. And there's many observations in this book that have been borne out over the last decade. We're also very fortunate to be in this particular place on the planet, that is the Bay Area, which is just a hotbed of innovation, as you know, and particularly at this moment in time, a hotbed of innovation in advanced data science and artificial intelligence and many other tools that are now available that were essentially predicted to be necessary to bring the full vision of precision medicine to the forefront. So we're at a moment in time where these tools are likely to transform many of the things that we do in biomedical science and in healthcare. And while there's huge opportunity and great deal of excitement around it, there are also challenges that I don't need to enumerate, but they're the kind of things that you all are going to grapple with today. Certainly, we must be mindful of ways that biases and injustices can come into these tools. And certainly history tells us, present history tells us, that that is indeed a real threat. So today's workshop topics and goals were selected really branching off from UCSF's what we call our pride values. And for us, pride has many meanings, but for us it means professionalism, respect, integrity, diversity, and excellence. And I think those 5 words can help guide the discussions around algorithmic justice. I don't know who brilliantly came up with that name for this session, but I think it's a great name. So throughout the day, you can look forward to a very dynamic program. I think there's going to be breakout groups and lots of time for active discussion and in-person interaction. And I know there are a lot of people online, and I think this is going to be a real moment in time where some important observations and learnings can drive what we do going forward. So I thank you all for being here. Thanks, Keith, for the opportunity to join you, at least for the beginning sessions this morning. And I look forward to getting a full debrief after the day's over. Thank you.
Thank you, Sam. And I'm glad my mom's not tuned in, because I forgot to introduce myself. She would have not been happy about that. So I'm Keith Yamamoto, as Sam said, the Director of Precision Medicine here, and Vice Chancellor for Science Policy and Strategy. I thought it would be good to say a few words about the origin and rationale and development or creation of today's program. Why algorithmic justice? Why a workshop? Get to that. Why precision medicine centered? Because I think that if we can do that, it may help to provide some clarity to our goals for today and the ways that you think about and comment on and provide wisdom for achieving those goals. So let me these why questions, and let me start with precision medicine itself. Precision medicine is, as it says here, an approach to using advanced computing tools, AI, to aggregate, integrate, and analyze data from basic and translational science, clinical science, and from people, patients, community members, in their environmental and population health contexts, to better understand biological processes and to define disease mechanisms and predict more precise diagnostics, therapeutics, and prevention measures. The idea behind all of that is that if we could somehow, that is, use computational tools to bring together all biological data, experimental organisms, human populations, and put them on a common platform that allows their comparison to reveal patterns and correlations that couldn't otherwise be detected, then we could move toward precision. That is, being able to advise you as an individual, not you as a member of a statistical group, but you as an individual, about your health, your risk for disease, what the progression of that disease, if you happen to get it, the best therapeutic pathways, and the things that you need to move through a therapeutic regimen as a disease would progress, and hopefully, of course, cure and prevention. Being able to do that at the level of the individual is the goal, and that's where the precision in the term precision medicine comes from. As Sam said, precision medicine is UCSF's principal institutional strategy for organizing and integrating and implementing research, health, and healthcare. And as we've implied, precision medicine's principal enabling tools are AI algorithms. So you can see from that in a way, we had to stand up this workshop because for precision medicine to succeed requires that we actually get it right, that we ensure that the data sets that are used to train the algorithms are free of biases, that are fully representative, and so forth. Because if we don't, precision medicine will fail if those data sets are biased and or the algorithms are flawed. So that's really the rationale. And it means that we all need to be thinking about how to do this well. Now, when I say all, if you look at the description of precision medicine, you see an important inference, and that is that precision medicine is not just a tool to use on campus here that pulls together the researchers and practitioners and doctors and nurses and pharmacists and so forth that are delivering care, but in fact also requires the participation of the patients and the community members who aren't patients, thank you very much, and don't want to be patients, to provide data. And they, at the end of the day, will be the subjects, the users, the consumers of these algorithms. So it stands to reason that if we're going to get it right, we're going to have to include them in the conversation, not at the end when everything's already out into the public, but at the beginning and in the middle, so that we learn what the community impressions are. We gain that wisdom that we're otherwise bypassing. This is a really critical part, is that the scope of the effort is much greater than just those of us who happen to work in this institution. So we began to have, the precision medicine program people began to have conversations with others on campus who have expertise that we don't have and could help us to think about and guide the planning process for this event. And a very UCSF thing happened. And that is that as we talked to these groups, they not only shared their expertise, but they expressed a good deal of enthusiasm to be in the process with us as partners. And so at the end of the day, the precision medicine program has said, well, we need to plan this. Actually, I should actually step back a step further and say that this really all began with a conversation that I had and Ben Rubin had with Monica McLemore, who's here and participating today. Monica, at that time, this is back in the pandemic era, remember that, those wonderful days. Monica was at that time a faculty colleague here in the School of Nursing. She is, I would say, a justice activist. How's that? And she was also at that time a member of a working group we had in the precision medicine program called Structural Racism in Precision Medicine. And those conversations evolved into a kind of an egg that said, maybe we should really put together a campus-wide event that would get everyone involved in the conversation. So it was from that then that we then ended up talking to the various groups on campus, and they expressed their enthusiasm to be sponsors. And so now there's 8 sponsoring organizations. Yes, it was launched by Precision Medicine program, but every one of these programs has participated in active and essential ways to make this thing come together. The ideas and wisdom that we gained from that all funneled through a terrific planning committee that Ben Rubin, the Associate Director of Precision Medicine here, headed. He is really responsible for an enormous effort to really pull this whole thing together. So we are very grateful to him and to the committee members that were involved. And that committee was engaged in an almost constant conversation with another committee an advisory committee that was composed of community members, ethicists, social scientists, and computational experts that came together and met often. Ben organized them, but he didn't lead them. They weren't edited by them. Instead, he really listened to what they had to say and brought back to the planning committee their impressions and feedback and advice. So it was really this kind of constant trade-off. There was a period toward the end when each group was meeting in alternate weeks, and Ben was the shuttle that was providing the feedback information. Really important. Okay, and before I leave this kind of listing of people, this is an ideal time for me to thank the people that did the logistics that's making this whole thing come together. Implementation team headed by Angela Gross, but others as well. And a set of volunteers and additional supporters. I hope the additional supporters were not coerced instead of volunteering, but okay. I think that's great. So, but we really do appreciate, again, a huge effort to really make this thing happen. Okay, so the goals that emerged from all of that work are listed here. You'll immediately recognize them as verbatim statements of the three topics that we're going to wrestle with during the day today. I'm not going to detail those goals, just to say that they reflect, I think, a reality that we came to understand in the planning process, that the kind of data-centered integration of research, healthcare, and public and population health data is a huge computational technical challenge that is itself embedded in another set of huge challenges, which is this web of ethical and equity issues. So I'm not going to detail the goals. You can read them and they're in your program. And more importantly, Ida Sim, when she gets up here a bit later, is going to highlight them in more detail. But what I do want to say and point out is that as you look at those three sentences, they're all driven by, initiated by, what my grammar school teachers would tell me are active verbs, right? Advance, engage, ensure. That says that the output that we want today will be grounded, yes, in deliberation and discussion, but then what we want is action. And to be able to do that, be able to achieve those three critical steps, is going to take input from experts. So who are the experts? Well, this is a workshop. It's not a lecture. It's not a symposium where big shots get up in front of the room and talk at you, but it's a workshop. Each workshop participant has unique experience and knowledge. That's just the fact. Therefore, each workshop participant is an expert. Each of you has got stuff that the person next to you doesn't. So the success of this effort is going to depend upon hearing each other's voices. So you're all experts. Thank you for coming, and thank you for sharing your expertise. The team, the planning team, has created multiple opportunities for you to share your input and feedback and suggestions and complaints that will be described to you in a couple of moments. So, if you'll allow me to remind us of some useful guidelines for engagement, I'll close with that. These are all common sense stuff, but it's not such a bad thing to kind of in a setting where people some of whom don't know each other all that well, are coming together, and we all have a responsibility to share information. Ask challenging questions. There are no bad questions. Be open-minded, listen, accept risk, learn from each other's differences and backgrounds, acknowledge biases and assumptions, including yours, accept that some things or issues may go unresolved, agree to disagree in seeking to achieve greater understanding, balance listening and sharing, respect confidentiality and privacy, and be time respectful. Be brief with your questions and comments. Avoid piggybacking just to voice agreement. Okay, so that's it. And I think I'm really looking forward to what I think will be an exciting and really hopefully rewarding set of conversations today. Thanks to all of you. So now it is my pleasure and honor to introduce our keynote speaker, my good friend Alondra Nelson. Alondra is a scholar, writer, and policy advisor, I guess, policy maker in my view, who works at the intersection of science, technology, medicine, and social inequity. Indeed, it's not a stretch to say that she has defined that intersection. Even before completing her PhD in 2003 at NYU, she was sought after and influential. In an oft-cited 2002 essay, she issued a stern proclamation, stern pronouncement to technologists and to all at that time who may have been projecting that AI and other related tools could be a gateway to a utopian era free of bias. And actually, I've got a last slide that I'd like to put up. You can get to that. Because she said something really important. And if you can't get to it, it's okay, I'll read it. So what did she say? That race and gender distinctions would be eliminated with technology was perhaps the founding fiction of the digital age. Strong stuff for a graduate student, I'd say. So be it. Since 2019, Alondra has been the Harold F. Linder Professor at the Institute for Advanced Study and Distinguished Senior Fellow at the Center for American Progress. She started her academic career at Yale and then moved to Columbia, where she was the founding dean of social science. And among her contributions, she launched the Institute for Gender and Sexuality and the Precision Medicine and Society program. In fact, I looked at some of the things that she did there. One of the events that she sponsored was titled The Promise and Challenge of Precision Medicine, an Interdisciplinary Conversation. I would love to have been there for that. Her many writings include 2 highly recognized and multi-awarded landmark books exploring race and technology. One, Body and Soul, The Black Panther Party and the Fight Against Medical Discrimination. And the other, The Social Life of DNA, Race, Reparations, and Reconciliation After the Genome. From 2021 to 2023, early this year, Alondra was the first Deputy Director for Science and Society at the White House Office of Science and Technology Policy, OSTP. And concurrently in 2022, she also served as the acting director of OSTP and deputy assistant to the president. Among her many accomplishments in that short time, she did an enormous amount. Let me just mention 3. One, she launched 2023 as the Year of Open Science, which was really a coordinating program across the federal government to advance open science policy, promote public trust, and drive equitable science and technology outcomes. 2, she issued a guidance memorandum, which in the federal government is called a rule, which was for all federal science and technology agencies, ensuring free, immediate, and equitable access to federally funded research, free publication at the time, free reading at the time of publication. 3, a blueprint for an AI Bill of Rights, a set of 5 principles and practices for the design, use, and deployment of AI algorithms that protect civil rights. Can't get the impression that she's a pretty good speaker for this group. Alondra, welcome to UCSF.
Good morning, good afternoon, good evening, as I've been taught to say from working in government when you're speaking to people from all over the world. Well, thank you, Chancellor Hawgood, for that welcome and for that introduction. Thank you, Vice Chancellor Yamamoto. I mean, what to say about Keith? I heard at dinner last night that he had been fighting the good fight, doing his work on this campus for 50 years. I mean, unbelievable, but not a surprise for any of us who've worked with Keith, and who, you know, we know has always done it with an eye towards equity and an eye towards justice issues, which was not always the case in the fields in which we work. And so we all owe a deep gratitude to Keith for his particular type of leadership that produced not only the National Academy's report on precision medicine that brought attention to issues of ethics and equity and justice, but also more recently, a consensus study for the National Academies that he co-chaired with Keith Walu that brought sort of equitable innovation to the fore yet again. So we owe him for so much for that and so much more. I want to have special greetings to my friend Janet Shem. I like, so the pandemic overlapped with me working in government, which was like almost being in a pandemic, like you just lose all your friends and you don't see anybody. And so for about almost 3 years, I haven't seen colleagues. So it's great to see Janet, great to see Jessica Newman as well. Thank you, Ben Rubin. Thank you, Dr. Lamore, and all of the planning team for all that you did to get us here today. So let me just say, I've got more slides than time, so I'll zip through, but just to maybe raise a couple of provocations as we get started in the conversation today. And I'm just so delighted as I'm restarting my research program after public service to have the opportunity to spend the day thinking and working with all of you. So I want to begin by giving a bit of a context, right? I mean, I think there's a way we can have a workshop like this around precision medicine and the promise of precision medicine, you know, the hopes for it, without this larger context. And many of us have been working in this space as it went from, you know, Department of Energy supercomputers and the Human Genome Project to the moment that we have now. And we have been sort of working in our own sort of silo or with our heads down. We've been engaging, many of us, local communities and a wide range of stakeholders, but we really never had to engage the public in the way that we've had now, right? So over the last 9 to 10 months, we have had a sort of a flowering of public understanding and appreciation of artificial intelligence, automated tools and systems, in part because we have these new tools that were introduced as consumer products for the very first time. And so those of us who sort of sat in rooms or Thanksgiving tables or elsewhere where people would glaze over when we were talking about sort of GWAS and you know, AI and you know, genetic data, now sit at tables in which people are deeply kind of engaged in those conversations. And so I think it's always been important to think about that kind of broader context for AI. But I think for me, I mean, my sort of headline of my talk today is like, it's about the people and their well-being and their lives, right? So this is why we're doing all of this. And that those people are reading these headlines, are sort of thinking about it, about their AI with regards to their work and not just their healthcare and other things besides. So I just wanted to bring that kind of broader, rich, complicated, tense context into the room, but also a reminder of how the planners of this workshop were quite prescient and sort of, this has been in the planning for months and months, as Keith sort of laid out. But like after I called last week AI Palooza, I mean, I can't imagine, we've had the safety summit, the president's executive order on AI and lots of other things besides. And as Chancellor Hawgood said, it couldn't be more timely. So one of the things I want us to think about today, I mean, Keith talked about bias issues. This is an important paper, Obermeyer et al., that many of us know from 2019, that showed how algorithms not only could be biased in the training data, as Keith sort of suggested, but also could exacerbate bias, right? So if we're here for the people, if we're here for health equity, if we're here for better outcomes, we certainly don't want to be sort of, tracking the trend of current bias that we have. And what this paper sort of pointed out to us was sort of, please be careful, because you might indeed be exacerbating it. So in this instance, an algorithm was over-serving to people who had already received lots of care. And why did they receive lots of care? The implication was that because they were sicker, but it was in fact because in a sort of capitalist-driven healthcare system, they just had more healthcare resources. So it was sort of those who had getting more, and those who did not have getting less. So, and then of course, there was an important paper a couple of weeks ago about the use of large language models, that tested 4 different large language models. That was in Nature Digital Medicine, did some benchmarking of 4 chatbots around, questions that people might ask of a chatbot, and found that in some instances, there was this kind of proliferation because of the training data set of race-based medicine claims about racial distinction of bodies and of outcomes and lung capacity and these sorts of things. So those are things that we need to sort of think about. But I also want to raise this other set of kind of concerns and issues. And one of them is about, I worry about the compounding. So Keith sort of said we've had this kind of nesting cluster of issues. I want to raise to our attention this morning a sort of compounding techno-solutionism as a problem of advanced AI tools and systems, right? So Human Genome Project, 1990s, Department of Energy supercomputers, impossible without the beginning of expansive new computational possibilities. And we've seen that over the last 3 decades. The challenge that we face with AI and the kind of mystification around it. So I just pulled this, I'm not trying to pick on these particular researchers. I just chose it as to show a particular trend that principles for successful adoption of AI in healthcare include data and security, analytics and insights, and shared expertise, right? So there's not about people getting better, healthcare, medicine. I mean, and so we risk compounding the sort of really exciting technological innovation that has made human genetics research and things like precision medicine possible with a very narrow sort of technocratic sort of technological approach. And AI makes it all the more easier to do that, right? Because in some instances, it's really cool technology. So I want to offer this morning that algorithmic justice should be not merely the absence of harm. So we want to find bias. We want to target it. We want to create data sets that are richer and better and don't allow that. But that the goal is people and people's longer lives, better lives, more empowered patients, people with healthier lives. And that algorithmic justice wants to take a perspective that's not only about the technological innovation piece, which is always keeping this kind of broader context in mind. So I want to tell you a little bit about how we tried to do this in my time working in Washington. Keith mentioned that I led a team that developed a white paper that was codified with the power of the president's pen and last Monday with the executive order on artificial intelligence called the Blueprint for an AI Bill of Rights. And I want to I'll tell you a little bit about the blueprint, but I also want to tell you how we did it, because I think it matters for how we do our work, even in the most kind of technical, specialized algorithmic ways. So this is we did an op-ed, Americans Need a Bill of Rights for an AI-Powered World. Actually, we didn't call it an AI Bill of Rights, but the editor at Wired. So this came out in Wired. So we sort of announced to the public that we were doing this sort of planning process in which we were going to engage the public in thinking about the work of algorithms and algorithmic systems and AI in their lives. This included lots of things, including in this instance, at the end of this article, an email address that you could write to the White House, anybody, about how you felt about algorithms and how they were, impacting your life. We had working sessions. We also had open panels that anyone could attend. We had listening sessions. We used the FDA model. Anybody could come for 2 minutes and speak their piece about this issue. We had a request for information about biometrics and facial recognition technology and more besides. And so this was, imagine sort of coming into office in the midst of the high watermark of the pandemic, where there was a lot of distrust of government and what's going on with science and sort of misinformation and disinformation. We felt an acute responsibility to really make sure that we were reaching out to people and having them not be able to say they didn't get a chance to engage in this process. So as Keith mentioned, 5 principles, but they're also practices. So that AI systems should be safe and effective. That you should be protected from algorithmic discrimination, that people should have an expectation of data privacy, you should have notice and explanation, and that there should be some sort of human alternative or fallback when you're getting an algorithmic decision making. So this really built on the work of the Obama administration. And I want to remind you, I don't know if some of you, Keith will certainly remember this, but when the Precision Medicine Initiative rolled out, it was certainly this big investment and this federal commitment and partnership, public-private partnership to doing the research. But there were these privacy and trust principles at the same time. And I would want to bring those back into our conversation today about algorithmic justice, right? That there should be good governance of the systems, that there should be transparency about the databases, about the systems, about the work, that there should be respect for patients' preferences, that there should be participant and engagement throughout the entire kind of life cycle of the process, that there should be data sharing access and use, and their concerns about data quality and integrity. So I hope that we don't lose as we sort of become more sort of technological and the AI systems that we're using in this work become more sophisticated. These kind of central principles around privacy and trust and earning trust, moreover, that were central to the work of the Precision Medicine Initiative. And I wanted to remind us of all of that. So you can find the AI Bill of Rights online. Just wanted to say that it's a framework around the deployment and development of AI tools and systems, that it offers a kind of technical companion. So it was both, if these are our values, if our values are safe and effective systems, if our values are protections from algorithmic discrimination, if our values are data privacy, how do you operationalize those variously in different kinds of use cases across the federal government and potentially in the public? So there's sort of checklists throughout. You can have proactive assessment of equity and design. You can guard against the use of proxies that for the federal government in particular and for business offer challenges if they're kind of protected categories. So we know about the challenge of proxies and human genetic research. Are you assessing disparities? Are you mitigating disparities? Is there ongoing monitoring mitigation for these systems that are kind of constantly iterating? How do we think about governance and policymaking in a deeply iterative space? So I just want to say 2 things about healthcare, given our conversations today. When we rolled out the AI Bill of Rights in October of 2022, so a year and a couple of weeks ago, there was attention here explicitly to healthcare providers and to patients. And so some of these things that were just getting stood up. So HHS was just releasing this kind of vision for advancing health equity by design that very much was looking at how HHS's use of development of algorithms, use of algorithms, purchase, as a vendor and a procurer of algorithms, how it was including methods to reduce algorithmic discrimination in healthcare, for example. And so lots of rules, as Keith said, rule-making processes and the like. These were sort of embodied. And I hope those of you who find yourself in the advocate space, whether or not your advocacy is as a researcher, as an activist, or somewhere in between, this is the executive order that was released on Monday. It's 111 pages long. Nothing that's in it will be accomplished without people from the outside putting pressure upon government to care about it. So these are just pulled some of the sort of pieces around innovation and with regards to healthcare. So collaborating with private sector actors with HHS to support the advancement of AI-enabled tools that develop personalized immune response profiles for patients consistent with another part of the order. So the question here is sort of how do you do that with the sort of all the groundswell of information and resources that will come out of this workshop? How do we show government how to do the work of driving healthcare innovation using AI tools and systems responsibly? We don't yet know how to fully do that, right? And so it's going to really fall to the research community to figure out in part how to do that in collaboration with patients, with impacted communities, and with community groups as well. All right, so let me just wrap up. I'm running out of time. So, I would just say, it's values all the way down. So people in the tech world or in Silicon Valley, you will talk about all the way down the technology stack. I want to talk about the value stack, right? So under what conditions are AI tools and systems being developed? What communities want these systems and tools developed, which may not, and I think that there needs to be in the space of precision medicine, and if we go back to those precision medicine principles from the Obama White House, respect patient preferences. Do they want to be included in the data set or not? Do they want to have genetic whole genome profiles or not? I mean, that needs to be a reasonable kind of conversation and expectation of the work. And if we really do care or moving towards algorithmic justice. Who decides when and how AI systems and tools are deployed, and through what process, who benefits and who does not, which is the primary question. All right, so my last slide, which is I'm ending sort of every lecture with this slide these days. This is from a very young W.B. Du Bois when he was writing his effectively his senior thesis at Yale. In 1898 with William James. And he says, given a universe with two possible futures, the question becomes to each individual, how much difference will it make if this be tomorrow's universe rather than that? In other words, the great question the world asks is how much better is the best possible universe I can help make than the worst possible? So this is the work, I mean, I think he was 17 or something. This is the work I think that faces us in the space of algorithmic justice. And I'm delighted that we get to think about that work together here today. So thank you very much. And Ida, over to you.
Thank you, Dr. Nelson, and also to Vice Chancellor Yamamoto and Chancellor Hawgood. I'm so excited to be here. This is a time to reflect and to think and to act. Can't really emphasize that enough. There are many activities going on at UCSF where the output from this meeting is going to directly inform our actions that are going to happen this afternoon and tomorrow. I do want to go back to the through line you've been hearing today about precision medicine, and that's the driving sort of motivation behind so much of our work at UCSF. And we always think of precision medicine as being precise to our bodies, our cells, our genome. It's also precise to our individual humanity. And I think we really need to think about that and what that means in various parts of our humanity. And if we think about it, we know that things like stress, things like racial trauma, things like interactional challenges in our life actually are etched in our own bodies. It affects our epigenetics, it affects our immune system. So it's actually part of the science too. As we do this work, we are actually doing science and we advance our science as well as impacting society. So I come here wearing two hats. One is a co-director of the Computational Precision Health Program, a joint program with Berkeley, where we're really at the forefront of AI in medicine, but also with my hat as the Chief Research Informatics Officer at UCSF, where, as I say, we're working very closely with UCSF Health and with really the whole campus to think through some of these issues of how we safely deploy AI, both for across all our missions in education, in clinical care, and research. As you've heard from Professor Nelson, many principles. Here at UCSF, we have adopted the Health and Human Services AI principles, but that was before generative AI. We need to expand some of these principles that we've been thinking and working with. But at the end of the day, principles are only principles we need to implement. And as I said, there's no time to lose for implementation. So for this particular day, we have looked across lots of resources for a framework for how to structure our day with you today. And I will hit B, oops, yes, here we go. And we adopted this framework from AHRQ, Agency for Healthcare Research and Quality, and also from the National Institute of Minority Health and Health Disparities, because it really captured what we want to focus on today. Quickly, I'm going to go through the middle bubbles here, phase 1, 2, 3, 4, and 5. That is the life cycle of an algorithm. Okay, so it starts out with problem formulation, which is super important. If you formulate the wrong problem, you're going to build in your biases. That's the main thing I tell my graduate students. Ask the right problem. That is the hardest thing to being a scientist and actually to being a policymaker. What is that question? Phase 2, data selection, assessment, and management. We've heard a lot about how that can bring in bias, super important. Then you need to develop and train your algorithm and validate it. I would say you need to do this in the real world. If you do this in a toy environment, you're not going to be incorporating the real biases and confounders in the real, for example, and you're gonna be inaccurate at the end. You need to deploy right in the target setting. Huge challenges there. Deployment is a combination of technical workflow, human cognition. It's very, very complicated, actually a discipline in and of itself. If we have that sort of techno solution optimism that Dr. Nelson was talking about, we're going to miss the human element. And then monitoring, super, super important. We talk about drift, talk about data drift, concept drift, drift in how we actually use the system that can introduce biases. So please keep this in mind, this algorithmic life cycle all the way around today. I'm sure it's going to come up. So we structured our day around the principles in this framework. The first one, promote healthcare and healthcare equity during all phases of healthcare algorithm lifecycle. Well, that is our workshop. That gives a frame to us. Guiding principle number 2, ensure healthcare algorithms and their use are transparent and explainable. That is topic 1. I'm really looking forward to that topic. I wonder if we're overfixating someone on explainability. Just because it's explainable doesn't mean it's right. And I don't, let's not overfixate on that. But I really want to hear, we really want to hear different opinions, even ones that might sound wrong. That's what we're here for. So encourage you to raise questions and help us think things through. Guiding principle 3, authentically engage patients and communities in the healthcare algorithm problem formulation, basically all 5 of the phases. And that's topic 2. Again, looking forward very, very much to that. I would emphasize the last point of that guiding principle, earn trustworthiness, and distinguish trust and trustworthiness. I think in technical worlds, we tend to say, I want to build a trusted system. And it becomes a technical problem. How do I technically build a trusted system? I don't think that's the right way to think about it. Trust is not inherent to a system. Trust is something given to the system by those who use it. So the system must be worthy of trust, and that trust is granted by those who use it. Trust is not inherent to the system itself. It's a dialogue, right? It's an interchange with those who use. And of course, depending on who uses it, it may not be trustworthy to different groups. And that's something we need to think about. So topic 2, looking forward to that very much. And then the last topic, ensure accountability of fairness and outcomes. Tremendous challenges there. Also a panel, I'm sure, that we're looking forward to. Of course, the operationalization of the principles need to happen at multiple levels, at individual levels, those of us who develop algorithms, those of us who teach. We need to implement and operationalize at the level of institutions. Here at UCSF, we're also talking, I'm sure Cora Han is there here, Cora, who is running the new UC Health AI Governance Forum that brings the 6 now medical campuses around University of California together. So multiple levels of institutional action, of course, federal action as well, societal level, at legislation, regulation that we're also keeping track of and participating. All of these issues are on board for the topics today. We have not constrained at all what people are going to talk about. We want your input, good, bad questions, no wrong, stupid questions, as Keith says, and focusing probably more on the institutional level again, because that's what we need your direction on today. We will be capturing what we hear throughout all the conversations, at the discussion breakout groups, also from those who are online. At the end of each topic, there will be a Q&A, and at the end of the Q&A, there will also be a brief period where we will ask for your response on surveys. And I think Angela is going to be telling us all about that. So we'll have instructions as we go, a very interactive day. Looking forward tremendously to the discussion and to the output. And yes, we will be acting on these. So thank you.